Now this is one of the very challenging CT scan of the abdomen, where we can see so many different unique findings. Now as soon as we start reading this CT scan, what we can see when we zoom in, the first thing which we can notice is this blackishness. Now I told this so many times, the most black structure on the CT scan is air. So this is as black as this. So this is outside of the body. This is presence of air into the room. So this is air, this is air. So this is all air, and this is a free air. Why free air? Because this air has taken the shape of abdomen, and the patient is lying. So there is a clear cut fluid and air level. There is a large fluid and air level. Now I have told this thing so many times. The most dense structure on the CT scan is bone. So this is the bone, this is the vertebral spine, this is the vertebra, this is the spine. The most dense structure is air, so this is the air. The less dense than air is fat, so this is the fat. This is all fat, which we can see very clearly. This is all fat, this is all fat, this is all fat. The blackish structure but less black than this air is fat. So this is all fat, this is all fat. So I told this thing earlier also, that in the fat, the fat should be kind of less black, and if there is no any inflammation, this black fat will look like this. So whenever there is inflammation in this fat, you will see a white streaks, white bands which are appearing. White means the hyperdense bands or streaks or lines will appear, which tells that there is inflammation of the fat because of some reason, mostly infection or inflammation. And here we can very nicely see that fatty infiltration. Just see in here. So this is definitely a small intestinal coils which are almost collapsed, because this is a CT scan of the abdomen, this is air, this is liquid. We can simply try to find out the liver. See, it is very easy. This is air, this is air, this is liver, because this is on the right side and this has dense white attenuation or radio density. Now the most important thing is on the right side the largest structure is liver. So this is our liver, and this liver is all pushed medially because of this fluid. This is all fluid. As I told this earlier also, that most dense structure is bone. So this is bone. Less dense than bone is soft tissue. This is soft tissue density, which is less white than the bone, and less white than this will be fluid or liquid. So this is water or fluid. So this is basically ascites. Accumulation of free fluid in the abdomen is ascites. So this patient has accumulation of free air, which is called pneumoperitoneum. So this is pneumoperitoneum. This patient has ascites, that is free accumulation of the fluid into the abdominal cavity. So this is ascites, this is ascites. These are the two kidneys. This is the left side kidney, this is the right side kidney, and this kidney look okay. They all the margins are crystal clear. There is not much infiltration, inflammation in the fat. There is no swelling in this pelvic LSL system. There is no any stone. So the kidneys are normal. So this kidney is normal, this kidney is normal, this kidney is normal. So there is pretty good ascites. There is pneumoperitoneum. The liver appears okay. The liver is shifted towards the left side, towards the midline. Now one sigma rule in the CT abdomen is the echogenicity of the liver on sonography, or the radio density of the liver on CT scan, should be as equal as spleen. So this is the left sided structure, which is spleen. So these should be more of equal radio opaque. There should be almost of same radio opacity or same whitishness. But in here what we are able to see is liver is okay, liver is looking white, but the spleen is not looking white. It is looking as good as liquid. See, this is the liquid. See the color of this, the shade of this, and the shade of this. So this is looking almost as equal as the liquid, and the reason is there is significant damage to the spleen. Now how do we come to know? The first thing is the radio density, which is very less. It means ki the spleen has lost its vascular nature. The second thing, in the spleen there should not be any air, but what we are seeing, these black dots which are as black as here, these are all black dots. This tells this is all blackishness. There should not be any air in the spleen, but the spleen has air inside the spleen. We get air only and only if there is damage or rupture of the gut, because gut has a lot of air, so there will be leakage of the air, but there is no reason why there should be air inside the spleen. So if there is air inside the spleen, it means that the spleen is damaged. There are so many bacteria in the spleen which are actually causing digestion of the spleen, means they are actually damaging the spleen. They are causing liberation of the air, and this air is there in not only in the spleen, but it is also going into the free abdominal cavity, which is causing pneumoperitoneum. So this particular patient had CA pancreas with complete splenic artery thrombosis. So the splenic artery was completely thrombosed, and that was the reason why the spleen was completely infarcted, completely damaged, causing liberation of the infection or liberation of the infected fluid into the abdomen. So this was all infective ascites, exudative ascites. Now how can we say that this is exudative ascites? If it is transudate, so in transudate we will see that in congestive cardiac failure or hypoproteinemia or hypoalbuminemia or in nephrotic syndrome, where you will not see the air. See this white, this dense black structure is all air. Air tells us that there is digestion ongoing or there is rupture of the viscera. The viscera is okay, so it is all the spleen which was completely infarcted, which was secondarily infected, and there was complete damage to the spleen, so it has lost the radio density. There was so much of air which was present in the air. There was pneumoperitoneum, and there were so many air pockets into the ascitic fluid, telling that this is all infarcted spleen. That's all for now, and thank you.